Dissection of aorta is a tear in the inner lining of the aorta. Aorta is the largest blood vessel in the body, carrying oxygenated blood pumped by the left ventricle. Left ventricle is the lower muscular chamber of the heart on the left side. Blood in the lumen of the aorta enters the break in the vessel wall and spreads along the vessel wall. When an aortic dissection spreads along its wall, the openings of the side branches can be blocked. The spread is enhanced by high blood pressure and a forceful contraction of the left ventricle. An aortic dissection can occur anywhere along the length of the vessel, right from its origin to its bifurcation in the lower part of the tummy. Dissection of aorta can also extend into the side branches like the blood vessels of the legs. When the blood vessels arising from the arch of the aorta are affected, blood supply to the brain is compromised and can produce stroke or loss of consciousness. Dissection at the origin of the aorta can obstruct the blood vessels to the heart itself and cause a heart attack as well. Similarly, blood supply to the intestines may also be cut off. Please view the full version of this video at my Cardiology Talks channel and subscribe for updates. Useful for early career medicos and paramedics. Link given below this video.